Dear students, you are welcome to this session. Today we're going to look at post-abortal care, which is a continuation from abortions, which we looked at last time. And my name is Kiden Robina. I'm going to take you through. So previously we looked at abortions, we looked at the different types of abortions and how they can be managed, how they manifest, Then we also looked briefly at what can be the outcome. There are those that can progress until the abortion comes inevitable, or sometimes the person can have the signs and symptoms, then the pregnancy grows. So we looked at all those. Now, today we are going to look at what if it becomes inevitable. If the abortion becomes inevitable, what should be done? So this is what we are looking at, the post-abortion care. Comprehensive care provided to clients experiencing problems from incomplete abortion, whether spontaneous or induced, is what is referred to as post-abortal care. Components of post-abortal care include emergency treatment. So in emergency treatment, we address complications such as excessive bleeding, infection, or retained products of conception. Then another component is family planning and counseling services. Here, the mother will be educated and provided options to prevent further unintended pregnancies. She will be given information on the different methods of family planning available and how she can avoid unintended pregnancy in the future. Then the other component is access to comprehensive reproductive health. We need to ensure the client has access to reproductive health services for continued care. So something very important we need to note is that we need to prioritize controlling and preventing post-infection during all procedures that are to be conducted in post-abortal care. Care after manual vacuum aspiration. So manual vacuum aspiration refers to the removal of products of conception through using manual vacuum aspirator, and this one can be effective when the pregnancy is below 12 months of conception. But once it reaches 12 months and above of conception, then another method should be used. So vital steps. The vital steps include the nurse needs to monitor the patient's vital signs, check for severe vaginal bleeding, and assess overall condition. Then we also need to allow the client adequate time to rest and recover comfortably. So aftercare guidance for clients. We need, as a nurse, we need to make sure that we look at the risk of pregnancy. The client needs to be informed about the risk of pregnancy. She needs to be informed that she is able to conceive even within 2 weeks after post-abortion care. So she needs to be prepared for that. That's why it's very important for us to provide the family planning services. Then contraceptive counseling. The nurse discusses safe contraceptive options available for immediate use. Then family planning services. We need to explain where and how to access family planning services, provide information on all available family planning methods to allow an informed choice. Then use of selected family planning method, Provide clear instructions on how to use the selected method, because the outcome will depend on how effectively it has been used, especially those methods that involve the mother to participate effectively, actively. For example, pills and also condoms. Then STD and HIV/AIDS prevention. So as a nurse, we need to emphasize to the mother that all the family planning methods do not protect against STDs and HIVs apart from condoms. So if the mother is taking any other type of family planning apart from condom, then she should be aware that she needs to use other ways to guard herself against HIV/AIDS. Warning signs. Advise the client to seek immediate medical attention for the following symptoms. In case the mother has been provided the post-abortal care and is having severe bleeding, she needs to come immediately for health care. Then, in case the mother has fever or foul smelling discharge, she also needs to get medical attention immediately. Then, recovery signs. The signs of recovery have to be discussed with the mother. This include menstruation resumption, which we expect that may be able to resume after the 6 weeks, but this is dependent on the mother. Some mothers can even take longer than that. So if it resumes, then it means that the mother has recovered well. Other things, recovery signs can be like, for instance, wearing off of a pain that was previously in the back or lower abdomen in cases where the mother had infection and was treated during the post-abortal care. Personal hygiene and resuming sexual activity. The mother has to be informed about the importance of maintaining good personal hygiene, and also to be informed that sexual activity can be resumed after 6 weeks. But she needs to know that the resumption of sexual activities after 6 weeks can lead to her consumption, her conception. So because of that, she needs to take the family planning or find other ways of making sure that she does not conceive. Provision of family planning method. Ensure the client lives with her chosen contraceptive method. So this is all about post-abortal care. We have looked at important ways, important kind of care that we need to give to the mothers who have undergone abortion or who are undergoing abortion. So that is it for today. Thank you for being part of this lecture.